So Healios is an organisation that's about how we bring new care models into young people's lives and involving the whole family, all using technology. So Healios is about redefining the mental health and neurodevelopmental services in this country into this new model of care that's combining face-to-face services locally, but with online solutions that can wrap around the lifestyle of the young person and their family. So in today's presentation, we covered off how we're working in a really exciting way with our NHS partners and third sector organisations on how do we design services that are not just fit for today's society, but that are fit for tomorrow's society. So how do we actually get on the front foot? And that's because there's so many forces working against the delivery of services today. So things such as we haven't got enough financial resources to support the system, we haven't got enough clinical capacity to meet the demand in the system. So today's presentation was about how we're working with the NHS and third sector organisations to bring these new hybrid services into those clinical pathways that allow young people to access care through a different channel that wraps around their lifestyle, and that sort of care includes services like initial mental health assessments through to complex services like autism assessments and ADHD assessments, and then a range of psychological services like CBT for anxiety and depression, all through technology. And that's some things that we covered off today in our exciting work that we're doing around the country in these new models of care. So ThinkNinja is one of our really exciting solutions that we built last year, and we are super excited about ThinkNinja. Now the reason we're so excited about that is it's to really help what we see as this growing mountain of morbidity with children and their mental health and challenges in this country. And that means that more and more young people are sadly being affected with their mental health. And so ThinkNinja is about delivering solutions through a channel that we know that these young people love, which is of course technology. They are digital natives. And the exciting thing about ThinkNinja is that it is an app that you download onto your phone, and it's about bringing education about good mental health into young people's lives, bringing skills as well that they can try to help with their mental health and emotional well-being and build resilience. So it's really about prevention to be rolled out at scale, and we're really excited about that. But then there's also this aspect about if they develop symptoms of anxiety or low mood, then ThinkNinja can also support in that sense and bring really important clinical evidence-based techniques to help a young person if they're feeling really stressed or anxious about themselves, or they have these sort of worrying thoughts and these different feelings that they don't quite know how to deal with that ThinkNinja can also support in that sense, all through this app. But then one of the things that we're really also excited about is that we're never about a dead end at Healios, and it's always about how you can provide further support for that young person if they need it. And so if they feel actually they need a little bit more than ThinkNinja, then they can activate some clinical step-ups and have actually a text chat with one of our live clinicians at Healios. And then if that's not enough and they need a little bit more than that, then they can activate another step-up, which is to have some live video-based clinical work, all within ThinkNinja. So this is about prevention and early intervention at scale, rolled out through schools to help keep our young people well. So as part of the morning session at the conference today, with great speakers, with Duncan and Andy kind of starting us off, and that was, for me, it was a highlight right from the get-go. And that's because we're talking about real public health issues, and this challenge that we've got about life expectancy has increased over the years and flattened off, but of course health expectancy now is going down. So the number of years that we actually feel healthy is being reduced. And that's something that we have to be cognizant of as we are thinking about how do we improve the health of the population and not just about redesigning services. And so that was the highlight for me as well. We have to think at that big picture level.